Hot take. When you have a doctor who is constantly afraid of potentially being sued, and that's how they practice medicine, you are very often getting worse medical care. And it's not the doctor's fault. That is something that has happened as a result of the society that we live in, because the risk of litigation in this country is so high. But what you don't want as a population and as a patient is to make your doctor feel like they have to practice what's called CYA medicine. The person who is practicing CYA medicine instead of treating you appropriately is very typically over-testing you, which increases overall healthcare costs, which increases overall delays within the healthcare system. There is a lot of pressure on doctors to do medicine in that way. So as an emergency doctor, here's what I think about when I'm taking care of a patient. I try never to focus on what someone else might think about the care that I provided. I try and consider what I would think if I looked at my own chart in review. If I saw that a patient came in for a certain reason and I did or did not do a certain test, when I looked at it myself later, would I be like, what were you thinking? And then I'm not saying you have to do or not do XYZ thing. You just want to make it clear in your documentation that you thought about it, why you think it is or is not something, and explain your clinical rationale. I think going about it that way can help us provide good medical care for people without over-testing, but also covering our A's.